All right, welcome to Orange Table Talk. We have this conversation every 2 weeks with different, with various women and men, we expect to have as well. Let's talk about issues that impact women, that can elevate women, that can help women to better understand themselves as well as to become more focused as a part of our society. We are joined by, that's not my name, that's Dr. King, like last week, right? Dr. King Goodall, right? Very famous, always listening from media. And Stephany Staple. Stephany is a farm supervisor and a community relations. And the conversation today is about something that most people like to really know about. They may be aware of the effects of it, but they don't know what it's called. Policies don't bear and see it. And it's right. And that's why I have Dr. King here, and keep us honest to this conversation. It's a disorder that causes anxiety, overeat, and it causes, it's far more than I think you know, and it causes, when the hormones start to go wacky, that's what we can do, go wacky, and the can't expect we don't know how to manage them. And I think it impacts on years about the 5% of women in childbearing age, more than 50% in one in 10 years. So, for every 10 women, I think I probably want psychologists to wear a season and that. And they are, and it's not an easy to live with. So we're going to start the conversation today, and I see doctors online, right? The audience are a bit low and distorted.
Yeah, I'm
That's
trying
how
to
we're
see.
going to tell you when you get second. All right, so we're not going to start the conversation until we fix it.
Danishka, I'm hardly hearing.
Yeah, not here.
Yes.
Let us check to see if the audio flow is in effectively, because they're not hearing it. All right, they're testing, still not hearing. All right, I currently see saying you're not hearing. We're testing the audio. Let me check on the audio. There's some in there. Let's fix the audio. All right, the audio is on wrong microphone. Are you hearing any better?
Yes, I am.
You are wonderful. We had the wrong microphone connected. Are you hearing Kern or Anastasia? You're online. Can you hear me? All right, wonderful. Thank you, Petty K. And Kenisha. Yes, wonderful. And our audience is building as we have this conversation. So, thanks, Tracy.
Great.
Good. All right, Kern, we got you. All right, thank you, guys. So we are here. We've put on the right mic, and we can have a real conversation today with two women who have had the experience themselves, and one who is a doctor who can help us to work out how to manage it.
That's right.
That's right. All right, Stephany, let's start with you. Tell us a little bit about what's going on with you and PCOS, as they call it. I know everything have to have an acronym.
You're right. It makes it easier to know what you're talking about. Some say PCOS, some say PCOS.
Right.
Yeah.
What do you say, Stephany?
Could you
Go ahead.
repeat?
Yes, what do you call it? PCOS, PCOS? What do you call it?
I call it PCOS. It's short and easy to say.
All right. Well, tell us a little bit about yourself and how has this disease impacted you? And when did you find out that you had it?
I was diagnosed with it from about 17 years old. I was in fifth form. I mean, I had symptoms. The first symptom I saw was irregular period. So I would have my period like twice per month, and normally when it comes, like probably 14 days, and then it break and then it come back. But at first thought I didn't really think anything about it. In my head, I thought it was normal because I was so young I didn't have anybody to actually share what I'm going through or anything like that. So that went on till about for 3 4 months. I remember the experience, the incident that happened that actually sent me to the doctor. I was having sports day at school, and my period was late, and my dad was like, if your period don't come, you're not going to sports day. And it didn't come all month long, and I said, no, something has to be wrong. And I went to the doctor, and I was terrible at explaining what was going on with my body because I had no idea. And she was understanding, and she said, okay, I'm having some sort of hormonal imbalance, so she's going to send me to do a pelvic ultrasound. I was curious. I wanted to know what was going on with my body, so I went and did the pelvic ultrasound the same day. However, I did not get to bring back the results until a day after. When I went with the result, and she was explaining to me that I have polycystic ovarian syndrome, I was lost. I have no idea what she was talking about. I was blank. And she started telling me about taking medication and all of that. And I was like, I am 17. What medication should I be taking at this age? And I did as I was told. I took the medication for about 2 months. I didn't went back at the time though to know if everything was okay. My period was stabilized, and that was at the time that was what I wanted. My period to stop come on and off and or irregular, as they would say.
Okay, so the first
And
thing
I
you
didn't, she was
thought
telling me about changing my lifestyle and all of that, but I didn't really pay attention. As I said, I was young, I was juggling school and stuff. So my health, I put my health on the back burner at that specific time.
okay.
When it comes to periods, I was feeling terrible pain, terrible pain. I was literally walking with pain medications to school to just to cope.
Okay.
So
So the
that
truth
was
is
how I found out.
is usually when you realize that your periods are either not regular or very heavy and very painful.
Or they don't come at all
Or they
for
don't
a
come
very
out.
while. That's one of the main things. The second main thing is the hair. You start to have a lot of hair. So you have no menses, but you have a lot of hair. That's usually like a telltale sign for persons that something is really
That something
not
is
so
really
right.
off. Yes.
Yeah.
And the medication that they usually get is
Birth
birth
control
control.
and pain medication
Right.
normally.
So if you are a young girl, like 15 and 16, and you're going to go home with birth control, your parents usually give you a hard time.
Side eye because for some reason birth control. Well, I mean, I understand based on the name. The only thing birth control could be used for is, because you're trying to prevent you from
Birth.
getting pregnant.
That's right.
Yeah, but there's so many other uses for it. So I really
It's
think we should
really
probably
just
change
it's
the
really
name.
just hormones.
Yeah, it's hormonal medicine, really.
It's hormonal medicine.
Mhm.
But that is actually a frightening thing for some parents when they are talking to their daughters, when they say,
Definitely.
boy, you have to get birth control. And they wonder, are you really trying to trick them? Because you really want to go out and have sex.
Right. That's it. That's mainly the problem, especially what I've seen with patients and their parents. Birth? Nope, absolutely not. What did you tell her when I had to step out or whatever it may be?
That's right.
Automatically think there's something else going on.
Yes. I say melanated queen talking about the pain is the worst part of
Oh,
it. Yes.
oh, yes, indeed. Oh man, I don't even want to remember the thinking about the whole aspect. But for me, at least, I had both PCOS and endometriosis. That was my diagnosis.
Wow.
So every month, I can just always count on the pain and no menses. That was the problem, really. So your pain is definitely.
But how does this, people, we talk about impact of kind of disease on your life. A big part of it must impact how effective you can be at work.
Yes.
And how effective you can be at school.
Mm-hmm. And interrelationally as well. Just overall, your lifestyle is just interrupted because of this disorder.
Yeah. How was that for you, Stephany, as a young student when you just discovered?
I was really, really depressed. As I said, I didn't have anybody to talk to. I was raised by my great grandmother, so I didn't have a sister or a family member or friends. And I really thought it was something I have to deal with on my own. So I was juggling that and preparing for CXC exams. So I literally remember times when I cried myself to sleep, asking why, asking my body, what is it doing? I was very, very depressed.
So tell me, does PCOS impact your mental state?
Absolutely. The imbalance in hormones can
Mm-hmm.
already predispose you to both anxiety and depression, but also the side effects and also feeling that you're not normal compared to other women, it can also affect you mentally as well. So not only are you predisposed because of the hormones to be depressed or have anxiety, but then you actually have reasons to develop these conditions as well.
Okay. And then on top of that, then you're having excess hair growth.
Right. And that's one of the worst symptoms, or hair loss, because what would happen is you can grow
We
hair.
get a hair growth or hair
And
loss.
hair loss, definitely. That was one of the major symptoms for me. I would grow hair as like a little beard,
Wow.
and then I would lose my hair. So it was really mind-boggling the experience to just know that sometimes you're here, sometimes you're not. Some days your menses will come in 15 days, and then 60, 70 days have passed and you see no menses, and you're wondering what's happening to me, you know? And then sometimes you'll be nice and slim, and then before you know it, you've blown up. And then in our culture, unfortunately, when you start to gain weight, the first thing people think is that you're pregnant.
Yes.
So imagine now, you're pregnant? No,
And
no.
then you're not seeing your period.
And you're not
so
seeing
must
your
be-
menses, you know? So you're just like, no, you know? The acne and the hyperpigmentation, the dark spots that come with it, it really, if you aren't comfortable or confident in who you are, despite what's going on, it can really affect you mentally.
So it really affects almost all of your body and your physical appearance.
Absolutely. And then the medication on top of that can also predispose you to depression, anxiety, and weight gain.
Okay.
Not that birth control causes you to gain weight, but it increases your eating, and when you eat more, you get more weight.
Okay.
Yeah.
All right. That's why I'm gaining weight. But tell me, Stephanie, tell me about some of your double whammy, as Patricia says. Yes. Can you tell me about some of the symptoms that you experienced after now the discovery of the regular periods and the excess pain? What then came for you? What else came for you as some of your symptoms?
Okay, I had problems sleeping. That was terrible. It's like sometimes I would probably sleep for 2 3 hours and then wake up in the middle of the night, can't go back to sleep. And not to mention the bloating. And as Dr. Goodall mentioned, people actually think you're pregnant. Most of my friends, like, they're looking at me, Steph, how your tummy getting so big? And I was really ashamed to say, okay, I have this, I have that. And I just couldn't bother explaining to people. And my weight gain, it just fluctuates. So this minute I would lose the weight, and the next minute I was like, I am fat. And it's not like I was eating a lot to gain the weight. And some people say, oh, you're eating off the food, so you're getting fat. So it was a whole lot to deal with at the time.
And the truth
And
is,
I realized I have these breakouts on my skin, like acne, and my skin getting really oily. And these dark patches under my breast, my armpit, it was a lot to deal with.
okay, so but you said it was. Is it better now?
A bit, a bit.
What's
I,
making it
I
different?
changed. I finally changed my lifestyle, so it's changing.
You change your diet, and what is it big change that you are making in your diet as far as you are aware?
Could you repeat?
What is a big change that you are making in your diet that you think is helping you?
I didn't hear that properly. I'm not
Yeah.
sure.
And okay, are you all hearing me online, or is it just Steph? Karen, you hearing? I see you saying the weight, acne, and hair is the worst. Yes, it is. It is really terrible. But What was the change in the diet that Stephany had? That she
Okay.
now.
Oh, she can hear you.
Yes, you hear? Yes. What's the change?
What changed? All right. When I was first diagnosed, the doctor was telling me a whole bunch of stuff that I should stay away from. The big one was dairy and all of that. But you start and then you stop, you start and then you stop. And I think it was earlier this year I saw Danishka advertising going vegan, and I said, okay, this looks like something I can do. And then I would actually have somebody to hold me accountable. So I said I was going to try, and I signed up for I think 10 days, and she did my whole meal plan and all of that. And when I tried it, I realized like my period came and it wasn't as heavy, but I still have the cramps and stuff. And I tried that. So then I came across the raw food challenge, and where we just went raw. So I literally eliminate all cooked food, the dairy, everything. And then my period came. I had no cramps, I had no bloating, I had no headaches. I was like, okay, I am finally there. And I went to the gynecologist because when I checked on the cyst last year, it was multiple on both ovaries. So they went around in like some little dark circles. Dr. Goodall probably knew what I'm talking about. So it was on both ovaries. So when I went about a month ago, one of my ovary is clear. But I still have more work to put in.
All right, Stephanie, you're putting a big plug there for Danishka, and that's Danishka Williams. You can follow her, Little Dan. She's doing the vegan thing. Yes, and then they're trying the raw food challenge. I'm trying to, but I am not as successful as you, Stephanie. But I soon work it out. And my problem is not quite the same. Mine is menopause.
Okay.
two different stages of life.
Two different stages indeed.
Yes, but one is someone asked me to do a program on menopause, one of the latest as well. And I will, because I don't think we realize how much hormones play havoc in our lives. We're talking about it in the context of women, but it does for the men as well.
As well, definitely.
Yeah,
absolutely.
but we are focused here on the women, and this is one of the ways that hormones really have a very negative impact on a woman's life.
Mm-hmm.
But as Stephanie is saying, one of the things that you can use is that. I think you are using the same.
More or less, something like that. But I guess we'll get into it.
Right, and let me just read Melanated Queen first. Melanated Queen says she has Ziz Naturals have products that help with the symptoms of PCOS, mainly soaps and teas. I'm trying to understand the soap part. And the phone number is 851-5597. WhatsApp me if you want to purchase and try them. But you may have to come and tell us how this soap would help, because I'm not quite sure. I guess with the dark spots, it helps to fix it.
More than likely the symptoms she's speaking of. And yeah, lots of soaps can help with the acne and the hyperpigmentation, the dark spots.
The dark spots. Yeah. Otherwise called the hyperpigmentation.
Mm-hmm.
Mm-hmm. All right, so educate us now, school us now.
All right. So I guess we can first start with the diagnosis of PCOS, also known as we've established, polycystic ovarian syndrome. And there are three things that we really look for, but once you have two of the three, then we would diagnose you with having the disorder or the symptom. The first would be having irregular periods or irregular menses. Once you have an irregular cycle, that's one thing that can point us to there being a problem, but there's so many things that can affect your period. So that's not the only thing we look for. The second thing that we'll be looking at is the presence of cysts on the ovaries. So a lot of the times when women come into the doctor's office and they say that they're not having regular periods, one of the first things that we do is send them for an ultrasound. So one, make sure they're not pregnant. Yes. And two, also to see if there's any abnormality within the reproductive tract. And then the third thing that we look for is a presence of high androgens. What does that mean? High testosterone levels or high hormones that are associated with male hormone, right? So we just say what they say and then just break it down. And that can be either by taking your blood and seeing if there is high levels, or if you have symptoms of it, such as skin, acne, or abnormal hair growth. So those are the 3 things to look for. But if you have 2 of the 3, then we say, okay, this is likely PCOS.
And then when you do that, then what's you first usually start with
so normally we
hormone treatment?
No, absolutely not. I mean, some doctors do, but our patients they're holistic. You look at a patient, every part of them, not just their body alone. So it's really important to get a history of what their eating habits are, if they have any family history, if their mother or their auntie, anyone in their family has it, so we can have an idea if this is a first generational thing or if it's something that passed down, because more while it's generationally. So it's likely if a woman has PCOS, their mother more than likely or auntie more than likely has it as well. So we take a full history to kind of understand who the patient is. Then we usually go lifestyle changes first, and then after lifestyle changes, including diet or exercise, then we go into the hormonal treatment. Because hormonal treatment isn't something that medication overall, this is what my strong belief, shouldn't just be thrown on a patient. You should really try to change lifestyle first and then help with medication if lifestyle doesn't help.
All right. So, but we don't call this PCOS though.
Right. So the exact cause for PCOS, there isn't a nail on the head cause. We just know what leads to the symptoms and the manifestation of the syndrome.
Okay. But so it's primarily lifestyles. What are the big things in lifestyle? Is it that everybody who have PCOS must go vegan?
No.
Okay.
So
about it.
really and truly, overall, as people, we really should have a predominantly vegan lifestyle, meaning even if you're not fully 100% vegan, it should be important that your diet consists more of fruits and vegetables and nuts and beans rather than animal products. Because
well, my father would not have agreed with you.
Most people will not agree.
Eat rabbit food.
Yes,
he never ate rabbit food. Yes.
They don't agree at all. But the truth is, overall health, animal products come with fat. And fat increases estrogen, and estrogen increases a lot of
But
issues.
all of us learn about the balance diet when we go to school, we go primary school. All of we learn about balance diet. Don't get everybody.
And
we did learn about
it's
balance
rapidly
diet.
changing now, because remember they used to have the portions and the meat look kind of close to the vegetables.
Right.
No, it should be half vegetable and then everything else.
It's just because you would like vegetables.
I actually don't. I don't. But I don't want my mother to hear, so hopefully she's not watching.
All right. So what we're saying is that we should increase our vegetable and fruit intake,
Definitely.
and that shift will also help. And Stephany, you are testimony to changing your diet shifts the outcome.
Definitely.
If you are hearing, Stephany not hearing so well, maybe we can type it for Stephany. So you're on mute. Yes. You're hearing what we're saying, Stephany? She's not hearing us. Yes? You have to, right.
I'm barely hearing.
Okay, not sure why. Is everybody else hearing? Can you tell me if you all are hearing? Yes, the audio is fine. Yes, I think we're, yes. Sharon, Herbalist Ross, are you hearing? And you approve this message. I like that. Tracy's hearing. All right, so let's see if we can work with Stephany to help her to hear. But so changing of that is
right,
the first
that's
thing.
a big one.
Mm-hmm.
That's what worked for me as well. So this time last year, I was at my peak in terms of the symptoms. I was losing hair. I would comb my hair and it was patches. I have hair now, but you know how it goes. Sometimes you just gotta wrap it up. But I was losing a lot of hair and the acne was just overwhelming. I was the biggest I've ever been, 178 pounds.
You?
Yes, ma'am. I was 178 pounds.
Really?
And I went down to 135 in 2 months. Yes, I actually have a YouTube video on it where what I applied to my life to ensure that I would not deal with this anymore. I was at my peak and I was really worried most and foremost about not being able to have children. Now that was the biggest scare because I want a full football team. Yes, that's another thing. And infertility is associated with this disorder. And I realized that, okay, every 4 or 5 months I would have a period and it would be very painful. And sometimes it would kind of come for like a day or two, because when it finally comes, it only lasts for like a half a second, and it's extremely painful. This whole excitement for nothing. And it was just really overwhelming, and I was at my absolute, I can't do this anymore, because it felt like my woman was being targeted. That's what it felt like. I didn't feel like a woman. I just feel like a normal woman who has her menses, who looked like one, because I would have hair. I had so much hair under my neck. It was
a year ago,
1 year ago, and in 2 months, everything.
And what did you change in that 2 months?
Well, I would boldly say the first thing I did was I went on my knees and prayed. I had to, because I felt like I had no other option. Like, I feel like a lot of the times when you turn to the Lord, you have no other option.
Okay, like so it was also affecting you.
Mental, absolutely. So I prayed about it. And
this is a big doctor came. Remember me tell you, 1 year ago she was at her lowest.
1 year ago, and I prayed about it, and the Bible says, James 1 says, ask God for wisdom and he'll give it to you. And he will give it to you without reproach. And that's what I did. And I went into the secret place, prayed with him, and he gave me step by step how to restore my body. Step by step. Like, I was in there step by step.
Very interesting.
Well, I spoke a lot about this on my YouTube video, but I'll give a little summary here.
Yes.
First things first was trusting the Lord with all your heart, lean not on your own understanding. That was the first one, right? Yes. So I said, okay, Proverbs 3 verse 5-6, let us put that down. The second thing was he gave me a whole formula to change my diet. He said, faith without works is dead. Yes, you can pray, and I will heal your land. However, I need you to put some steps into place, because I need you to know and understand that faith without doing anything at all, it's just not going to work. So I said, okay, Lord, show me. He changed my diet. I didn't even exercise. Exercise is important. I'll tell all my patients that. But for these 2 months, I actually didn't. I went into a place where I actually cut down my hours at work as well, because I needed the time to focus on what I was doing with the Lord. Gave me this plan, got the plan down. In 2 months' time, I went from 178 to 135. My skin, like, flawless, okay? And my mind, I slept at night, because I had a problem with sleeping as well. I would sleep for 1 or 2 hours a night. I didn't have that issue anymore. The acne cleared up completely.
And what was the diet that the Lord?
The diet, exactly. So the diet included, if I had a parent, couldn't eat it. That's just the best way I can put it. If it has a parent, don't eat it. If it comes from something that has a parent, don't eat it. So I had nuts, I had beans, I had fruits and vegetables. I had tofu as well, which also helps increase the estrogen. I realized that a lot of the food I ate had high estrogen, and what that enabled me to do.
So what are the high estrogen foods?
So we're looking at a lot of nuts, legumes. Tofu is really high in estrogen.
Well, really, I have to eat tofu because I need estrogen.
Tofu is pretty soy products. Oh, she's trying to do that. She's here.
No, but seriously. So high estrogen, it's important though, because it's the hormone imbalance.
You're trying to balance that.
You're trying to work through how to balance it, as well as other things in the whole process. So actually, less meat. So I mean, for Dan, going to get another plug again from Dr. Kim too.
Yes.
Vegetarian really
Definitely.
does help.
That's the answer.
It does help with this disease. And the foods that have high estrogen are nuts,
soy products, and even though we said vegan, fish. Yes, salmon.
Fish is salmon.
Yes.
I love salmon.
Yay!
But it's not on the vegan diet.
No, so what happens is going solely vegan is hard for lots of people. So if you can take baby steps, I mean, you don't go from being on the breast to eating a full meal, right? Babies, you grow up, you kind of have to go through the process. Right. So just to cut off causes a lot of people to just go back and just eat chips because I'm hungry. But if you take your time to get to that place, for me now, I don't solely eat vegan food anymore. However, 70% of the time, say 4 or 5 days out of the week, is predominantly vegan, and the rest, I will definitely have a piece of beef from time to time. I'm not going to lie to you, but I don't recommend doing that often. Right.
But I just wanted to point out here that this conversation is not just carrying us down a conversation about a change in a lifestyle with respect to that, but Dr. Kim was really declaring her relationship with God.
Yeah, that's first and foremost. Because first of all, I love shrimp. I love everything but shrimp. Curry shrimp, coconut shrimp, everything shrimp. And to not have it for 2 months straight, it was a 2.5 months. to be consistent and to actually have that driving factor. Stephanie spoke about having, I don't remember who she said that she had an accountability partner.
Danishka,
right? Danishka is her accountability partner.
partner.
And a lot of the times you don't have that. God's my accountability partner. So anytime I feel like I was about to go in the kitchen and whip up some beef,
you have to big up God.
Yes, I have to. I mean, I just can't do anything without, because he didn't just heal me of PCOS or heal that part of me, but my whole mind and my jaw, everything has been affected. And you see me now, you'll be like, you had ingrown hairs and you were that big. I'm a size 4 now, and I've been this way for 9 months.
And when you were at 178, you were a size what?
A size 10.
Size 10 to
Yeah,
size 4. 7 and 8, it means that she already did to lose the weight. She absolutely went full vegan for 2 months.
Right. And I also created a YouTube video, so just to big up myself.
Yeah, man, you can big up yourself, man. Hello, this whole show is about elevating each other, elevating
Absolutely.
women, and how we lift up each other.
Absolutely.
That's what we want to do in these conversations.
Yes.
So
yes.
sometimes it's going to get like heavy stuff, and we're going to do some legal stuff, and sometimes we're going to talk about some advocacy things, and sometimes we're going to talk about how do we make ourselves better,
right,
both physically and mentally.
Absolutely.
But tell me now, for the mental part, does diet help you with the mental part as well?
Absolutely. And diet and exercise help with the mental part, because the nutrients that you put in your body, the point of nutrients is to fuel the body. A part of the body is the mind.
Mm-hmm.
So if you're fueling the body with the right gasoline, you take a good proper gas and you put it in the car
Right now she just like give Crystal a plug, the gas.
Yes. Like it's just straight to the point, right? So if you feed your body what your body needs, it will operate optimally.
Yes.
Yeah. So definitely has a big role to play.
For sure. Stephanie, what about exercise in your life? Are you hearing, Steph?
Barely. I'm not sure if my internet is giving the problem or not, but it's in and out.
In and out. Well, I have to ask you about exercise. Do you exercise?
Yes, I do. And my job requires me to move a lot, so
Right.
I am.
Oh, no.
Where's your farm, Stephanie?
Repeat?
Where is your farm? I hear you are a farmer.
Oh, my farm is in Kitson, that's in St. Catherine.
Good. And what do you farm?
Well, where I work is a livestock farm, but I have a personal farm where I do crops like lettuce, sweet peppers, sweet potatoes.
Okay.
And that's in Clarendon. My personal farm is in Clarendon.
You're in Clarendon, is your personal farm. Yeah, you know I'm a Clarendon girl, right? You're in Clarendon is your farm.
Repeat? I didn't hear
Where's
that.
your farm in Clarendon?
Bradfield.
Frankfield. Okay, up in the hills.
Yes, you know there?
Yes, I know there. I was up there the other day.
Okay.
All right.
Okay.
So as we're having this conversation, we are also exploring. So we're seeing that these are two women with regular lives, different kinds of lives. One is a medical doctor, one is a farmer, both in her full-time job as well as in her own on-the-side business, right? And both have been diagnosed with PCOS, and both have suffered through the issue of the pain and the weight gain, weight loss, the skin issues, the hair. But what I want you to talk to me a bit now is how do you deal with the mental issue, anxiety and depression?
Okay. Well, I think we touched a little bit on it before, but the whole aspect of depression and anxiety. Now, I'm about to say this. Yes, I am. 3 years ago, I was diagnosed with major depressive disorder and anxiety disorder. And it had a lot to do with feeling like I had no control over my body. On top of being in medical school, I had 3 businesses on top of it. Was just a lot happening at once. So as again, I said last year, I was just like, okay, you know what? You know.
And I want you to pause here because I want to say this, because I want everybody who is listening or who will listen to this, is that you can be a successful person. You can have a lot going on in your life and at the same time have a mental challenge, have depressive disorder, have anxiety. So, that goes two ways, right? It's like it goes to say that something is wrong with you because you are having this issue, but it doesn't make you like a pariah in the society. And it also goes the other way to say that if you recognize that you are depressed, it means that there's a possibility also that you can turn this around and still function while being depressed and while having anxiety.
Absolutely, absolutely. Because you find that a lot of people think because you are successful that there can possibly there's nothing wrong with
you. Like, reason you have to be depressed.
Right. And also people who have anxiety or depression feel like they could never be successful because they have the issue. So I find that I really, really drive the point home about what I struggled with. And I say struggled because it's past tense, but I really talk about it because I want people to know they can have this issue and still be successful, and they can overcome it, because I have, so I speak publicly on it because I want it to be known that it's not a death sentence and it's not a box or a prison that prevents you from going to the next level of your purpose or your life, right? So to talk about the mental aspect, my faith really helped me predominantly with my mental aspect. And first things first is just knowing my identity. A lot of the times we struggle with identity as women. We have no idea who we are, why we are, what we aren't. And in really knowing who I am, no matter what changes, I know who I am. So if I have acne or don't have acne, or if I'm
still Dr. Kim.
I'm still Kim. You know what I mean?
Yes.
So it's important to know. Sometimes I put doctor on it. But first and foremost, I don't want, because I find that the name doctor, a lot of people are like, oh, doctor.
Yeah.
No, man, no,
what
doctor.
Means something study hard.
Yes, yes, it definitely does.
Farmer Stephany means something.
Absolutely.
So we can check you for some sweet potato, right?
That's right.
Yes. But, tell me something. You suffer with any kind of depression or anxiety in recent times, or only when you spoke about feeling uncomfortable when you're in high school? But did this have that impact on you at all?
It continued throughout my early 20s, and so I was like really ashamed of my body. I literally was wearing big clothes just to hide my belly. I didn't want to go out, and it affected my social life a lot. So, for example, when my friends say, "Hey, Steph, let's hang," I find all sorts of excuse just not to go. It was, I just didn't. I prefer to just stay home, sulk, and then I it's like I had accepted myself like as is. I said, okay, this is my life, and I think that was one of the things that drove me to still eat the things that I was supposed to stay away from. So I was saying, okay, I am already this way. Why not just continue down that path?
Okay.
So it was like that for me.
I tried counseling a few times. But the thing about counseling is it gets very uncomfortable. And when you're uncomfortable, for me, though, I just don't want to get deep. I'm like, I'm out. Goodbye. Oh, this is getting real deep now. So to be completely honest with you, it's something that I did try a few times. And I realized that the route I went was the most consistent route in terms of my faith, but I did try counseling.
You did try counseling.
I did, yes.
And it probably helped you, but you didn't know.
No, it definitely helped me.
Because got to a place you didn't want to go further with that counseling. It got you to that place that you knew what that place was.
Absolutely.
And it's an important part, because sometimes we think, because counseling is such a funny kind of thing, I find, because it's not the thing that fixes you. It helps you to identify how you can manage yourself.
Absolutely.
Because you can't be fixed. You are you. You are who you are. What's happening to you is that you're having a feeling about who you are.
Right. Counseling helps you to unravel the lies that you believe, or the unhealthy truths that you stand on. It helps you to kind of clear out the crack foundation so that you can stand on something a lot more solid.
Right.
You know?
Help you define and identify what that core of you is.
Yes.
What that core of you is. 'Cause the core of you is not that physical body that you were ashamed of one time, Stephanie. Because the truth of the matter is, and I want to big up Jamaican women for this. When you go to a dance with Jamaican women, no matter what the body shape like, or never shaped like, it is fully exposed and it is there in all of its glory.
They just
So there's a section of Jamaica that did not buy into this body shaming conversation.
Yeah.
There's some of us in the didn't buy into it. And we could learn that from those women. We
Yes,
could definitely learn that from those women. Really embracing your body with all of the foods. Right? And I'm working on that. I'm developing some foods and I'm embracing them.
It's really interesting in our country as well. Other than the folds, we tend to also bash very slim women. I didn't realize it was a thing until I became slim.
Really?
And they're like, "You look hungry." I'm like, "Oh, excuse?" Or like what?
So like there's a ultimate weight. There's like
there's like a middle ground.
Middle ground.
Not in it. You just like, "Are you sick? What happened? Oh my gosh, what happened? What happened to you?" So I realized that it's a struggle for not just the weightier women, but also the slimmer women. Like women overall, we just have to fit this mold or we're going to be targeted, and it's just so unfair. I know a lot of the viewers can agree with me on that. You can agree. So
and let me tell you, the box is hard to fit into because I don't think anybody fits into that box. It's
an imaginary box.
It's an imaginary box. And I see Kanisha saying that she had the same feeling, Steph. I guess this is when you were talking about it, that you didn't feel like going out and you wanted to cover up and hide your body. Because it is a difficult thing, especially when you are a young woman.
Yes.
Like me.
Even in relationships, I felt that way in like intimate relationships as well. I tend to hide my body from whoever I was talking to at the time, and it affected all areas of my life.
Mm-hmm. Tell me how did it and that is a very serious thing, because then you don't get to develop your relationships at the same rate because you are trying to hide yourself. So you're hiding your body, so then you end up hiding who you are. You don't share as much. You're kind of tiptoeing around your partner instead of really getting the fullness of that relationship.
Wherever shame is, there's no growth. If you're covering anything in shame, you're just stunting your growth overall. Yeah.
So one of the biggest things for PCOS is the shame that it causes.
Yes, it does. It's associated with
because
shame.
it causes a lot of physical manifestations that are not accepted by society.
Absolutely. That's so
like you get a beard as a woman and everybody says something wrong with her.
Mm-hmm.
Yes.
Yeah.
And when you think about it, there's probably so many women that have it in Jamaica, because I remember walking around and you'd see these women with beards, but they were okay with it. It seemed to me, but maybe it's just that they had to because they didn't know what else to do.
Truthfully, a lot of people are battling internally. Like, for example, me a year or two ago, you would never think that I was feeling on the inside what I was feeling. You would, because I was I seemed to be so happy, and I was just out there like, wow, she loves her body. Oh, wow. And on the inside, I'm like, okay, all right, kid, take it off. Okay, we're taking it off, and no one would know that I'm feeling that way. No one would know because you kind of put on this front a lot of the time when internally you're battling.
So if you could, what would you do to help girls in high school, or because it's in high school that it starts to occur for you, like second, third form, and you begin to start to have that. So what would you change or cause to occur in our society to help our young girls with this?
I definitely, as the key factor to overcoming self-esteem issues overall, because it targets self-esteem, is really enabling women or girls to know who they are, identifying who they are. So once they know that, nothing can waver them. They'll be planted on something firm. So I think that not just the PCOS, but overall dealing with this issue of low self-esteem is an identity crisis that a lot of our young girls have. So if we can target the identity and shaping and molding identity in our young women, we can definitely overcome low self-esteem overall and PCOS symptoms.
PCOS. But would you put PCOS like into the curriculum so the young girls would be able to understand and identify? How would you get this message out there so that people are experiencing this, understand how to attack it and how to manage it?
I actually learned about PCOS in school.
You did?
I did. I learned about it
What
in
high school?
biology. I went to Hillel, and we definitely learned it in biology, but it was in the IB program, and it was a higher level.
Yeah, because I'm just
Like,
remember that. Anyway,
It was the high level biology.
at CSEC. Did you learn about it in CSEC, Stephanie?
Yes, I did.
You did. Okay, so when you were learning about it, when you were doing CSEC, were you able to relate? Were you able to teach people about it?
Yes, I did.
Okay, so actually, so we can big up ourselves, and in our curriculum, we are dealing with some of these things.
Definitely, and I find that it's just getting better and better, truthfully, because I find that the young girls now, whenever we go to schools and speak, they are on the ball with these reproductive issues, because I'm a reproductive health advocate. So sometimes I go to different schools and just to kind of talk to them, but they're talking to me.
And they're
I said,
telling
okay,
you all
and they're
about
telling
it.
me all about it.
I think this is refreshing. So we are having a conversation here. Maybe all the young people are saying, like, why are you talking about them? Never know about this. Understand? Yes. But and I see Lorraine Miller talking about that. She's a country girl that lived in Kingston. And she recalled going home and her college teacher saying to her, "Yeah, mommy." Yes, mom, that's a problem.
Yes,
For real.
absolutely.
Yes, I would put a lot of reasons to Martha. You understand? But and what I do understand and what I'm hearing you saying is when you have that weight fluctuation from Marga to fat back to Marga, it also makes it difficult.
Very difficult, because one minute you're being praised, wow, and next minute you're like, what's happening to you? And imagine someone thinking that you're pregnant when you're fat, but then you have in the back of your mind, maybe I will never be able to be. Because with this particular syndrome,
yes.
you know, it's really hard for most women, especially if they have it for a long time, to get pregnant.
Right. So does the hormone treatment, if you do hormone treatment, will that help you with the ability to get pregnant?
Well, really and truly, the hormonal treatment is made to stop you from getting pregnant, right? Because it's a birth control. Now, what it does, however, is preserve some of the eggs, because what happens in PCOS, multiple eggs are released, and what's happening is you deplete your reserve earlier than you would if you didn't have the syndrome. Now, when you use a hormonal medication, it minimizes how many eggs you lose a month, right? So what that does is when it's time for you to have children, you come off of it, and then with some assistance or even naturally, you can have children.
So it can help if you do the birth control early.
Right.
Because then it will help with the preservation of the eggs.
Right.
Yeah. And you are a football team.
Definitely. What's beautiful about the situation that I haven't been on any form of hormonal medication for over a year. I haven't seen any hormonal pill because I'm telling you, the side effects of those things are really hard to deal with. But I'm not on any form of hormonal medication. I'm not currently eating predominantly vegan either anymore. I'm exercising once or twice a week, maintaining this weight, have no symptoms. My ultrasound is normal. You would never believe, based on my blood work, my ultrasound work, you see me how I live, that I even had this particular situation.
That's why you're saying you're a survivor.
That's why I say I'm a survivor.
What about you, Steph? What about you? Are you still on hormonal treatment?
Still surviving. I am still surviving. Since I changed the lifestyle nutrition-wise and getting more physical, I'm having no problems with my period anymore. My sleep patterns are better. The cysts are still there, but in terms of symptoms, nutrition helps me.
Nutrition helps you.
I'm no longer bloated, and that was my major issue. In Jamaica they would say the big belly. That was my major issue, and I am seeing changes there. So it has been a journey. It is still a journey, but I'm pushing through.
Well, I take it you don't have any children yet.
Not yet,
Do
but
you
you
have
know,
any children yet, Stephanie? Not hearing. Stephanie, do you have children?
No, 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 not yet.
You want to have children?
Yes, I do.
Okay. I don't take that for granted enough because I realize not every woman wants to have a child.
yeah, that's actually, I really appreciate that question because a lot of, so you don't have children yet? No, what if, no, some women don't want to. You're absolutely right. That's such a good question. I
Yeah.
appreciate that question.
Yes, because there's a lot more to us than just having children.
Who would have thought?
Big part of what we do. I'm very happy that I have 3 children, but it is not necessarily, it's not the be all and end all of
Yes.
who we are. But what you can know that PCOS is, it can be a debilitating disease, but it is one that you can manage.
Definitely.
And these 2 ladies are advocating that nutrition is a big part of managing it. Exercise is another part of managing it. And, you know, and for certainly for Dr. Kim, your relationship with God is a big part of it
Yes,
for her.
huge part.
A huge part. I would say to you, any of you who are struggling with depression or anxiety as a result of the changes in your body and the way that you are then relating to yourself, know that counseling can also be a part of your solution.
Absolutely.
As
Yes.
well, right? Well, what you do know is that what you see here is 2 women who are living with PCOS, who are very successful women. Successful women. One is a farmer and one is a doctor. All right. And what we are happy about is that in our schools in Jamaica, we talk about it.
Yes. Yes.
We are very happy about it, and that we are getting more and more open about our reproductive health and our reproductive process
Yes.
in our country.
Yes, it's really
Yeah,
good
man,
to
we
hear
can
that.
praise God for that one as
yes.
well, because then that will carry us to the when we have a conversation around sexual harassment and the relationship between
my
young boys and girls
Yes.
in our society.
And the young boys and
Yes,
girls.
and young boys and girls and girls. We're going to have to talk about all of those relationships together. But can I tell you, thank you, ladies, very, very much for joining me.
Absolutely. Thanks
Yes,
for
it was a nice
having me.
conversation. It was a good conversation. It was an uplifting conversation, you know. And as I say, this is Orange Table Talk. We do this every other week, you know, and this is where we are going to cover the topics. It's a series that where we talk about women's issues, women's rights, and this series is powered by the People's National Party Women's Movement. So please follow our page, PNP Women's Movement, and follow my page at Pat Sutherland JA. Now we're hosting it currently on Pat Sutherland JA. And we look forward to having more conversation about it. We had some good conversation during the talk today,
Definitely.
but I am pretty sure that when we post this online, we'll get some further comments on it. I just want to apologize, I had forgotten to, for Ali Matalon, who would have joined us, who is also living with PCOS, but she had a death in her family today. So Ali, our hearts are with you, and you know, prayers always, right? So thank you, viewers. Thank you, Kenisha and Melanated. I'm trying to remember Melanated name now. Judith Thompson, and Kern, and Lorraine. Really Melanated Queen. How can I forget the last name? The Queen, the wonderful Queen, and Stacia, really, and Petty Kate. Right. Thank you very much for joining. And Sharon Herbalist Ross. All right. So we had a nice conversation, and let's continue to raise our voices together as women. Let's elevate each other as women.
Absolutely.
This has been Orange Table Talk. Thank you.